Welcome to People's Choice by Intermountain Healthcare, where we get healthcare executives to guess what the public says about healthcare topics. Today we're joined by Todd Craghead, by Eva Korp, and Bonnie Jacklin. Please tell us a little about yourselves.
So Todd Craghead, Intermountain Healthcare, Vice President of the Revenue Cycle.
Good to meet you.
And I really like Groundhog Day. I think it's a pretty funny movie.
Groundhog Day, huh?
Yeah.
Funniest movie of all time, would you say?
It's one of those funny ones. So.
Punxsutawney Phil?
Yep.
Okay.
Waking up in the morning with
Eva?
phlegm.
Hi, I'm Eva Korp, the Chief Clinical Officer, and the funniest thing I ever watched is the Republican debate.
The Republican national debate. That's sad. Not a Trump fan, I'm gathering.
No,
At least maybe for comedy, but not for real
he
politics.
is funny.
Okay, says some funny things, evidently. Bonnie.
Hi, I'm Bonnie Jacklin. I'm the Chief Nursing Officer for the North Region for Intermountain Healthcare. And the funniest movie I ever saw years and years ago was called The Gods Must Be Crazy.
Oh, I love that show.
It's a
the
good
Coke
show.
bottle falls
Yes,
out of the
Coke
sky.
bottle falls out of the sky.
Great.
Perfect. Yep.
South Africa.
Yes.
Awesome movie. I'm with you on that one. It's
Okay,
funny.
perfect.
Great. Well, you remember the style of show? We interviewed 50 people about random healthcare topics. Your job is to guess what the top result was, what the survey respondents said the very most. So, first question. If you could make one change in healthcare right now, what would it be? One change. I think, Bonnie?
That's a
How much it costs?
Okay, lower costs. Survey says yes, lower costs. You take the board.
Woo, I'm
Let's
gonna
see
win,
response
I'm gonna
number 2 and 3. More patient-centered care and more transparency of costs.
All about cost.
Interesting.
Yeah,
So let's talk about that. Obviously, healthcare is not exactly cheap, but let's talk about what can be done to keep costs sustainable. What do you think? Revenue cycle?
Yeah, well, I mean, I think just ways to process and bring in and collect and help patients understand what their liabilities are could very much help kind of manage the control the
Okay.
costs.
Yeah. Other thoughts on that?
I think you need to give the consumer perception of what the true cost is, as opposed to the charges they get on their bill, which aren't actually what it costs to
Okay,
provide
so
the care.
more to the transparency of the cost.
Yes.
What's the best way to do that, to give data that's understandable to the average consumer?
I think we need to give them perspective of the cost before they sign up for a procedure, from the whole perspective. With the third-party payer system, the insurance covers it. They don't know what the real cost is, so we need to give it to them up front so they understand it.
Okay. Bonnie, what's the best way to do that? How do you give that data to the public in the easiest to understand way?
I think that's the hardest part of all, because there's transparency out on the internet right now. You can go and look at different things, different aspects of it, but trying to get that information to the public, you don't know who has access to what, or if they believe, because right now I can look and see from one health system to the next, the cost is different. They don't understand why would that cost be different from one healthcare system to the next. Or if I have one type of insurance, Eva has another type of insurance, our cost will be different also. So how do you give that information out? That's the hard part. But I also think one of the things we need to do is educate the public on what's necessary versus what can you do. Because necessary versus what can be done are two different things. You might not need that CT scan. You can do it, but you don't need it. So what's necessary?
So
And I
there's a
think
component of education between the
education that we
clinician
need to
and
make sure we do for our public. And I think that's the hardest thing of all.
Okay, yeah, great points. Now, especially for the two RNs that we have on our panel, let's talk about number 2, more patient-centered care. What exactly does that mean, and how is it going to help reduce healthcare costs or otherwise improve care?
Well, healthcare is designed around our systems today. It's designed around the physician, the nurse, the health system. To bring it to patient-centered care, we need to design it around the patient and the consumer. And consumers are driving decisions today on who's going to provide care to them, and it's easy access, and I want to be in and out. So we compete now in healthcare with CVS, and I can get in and out and get my flu shot. So that is how they're going to drive their decisions in the future.
Makes all the sense in the world. Bonnie,
I
anything
agree
to
with,
add?
I agree with Eva. You need to make it for the patient. She said CVS, that's convenient, I'm in, I'm out. How many times do you go to an emergency department or an Instacare where you're in, you're out? We need to make it convenient and make it where that's where the patient wants to go.
Great. Todd, anything to add
Well,
to that?
I mean, we're talking about the consumer, and the revenue cycle includes the registration process that occurs as the consumer enters into the system. And I think anything that we can do that would take advantage of techniques, technology that would improve how we can interact with the patient, or the consumer in this case, is going to make a difference all the way through to their care. And on the back end, when they have an opportunity to receive kind of that bill for whatever the services are, what their obligation might be, it does influence the way they feel about the care that they received from the patient perspective. And so whatever we can do to improve that's going to be important too.
Great comments. Thank you. Bonnie wins the round. Thanks very much, and Bonnie wins the round. Thanks for joining us for People's Choice by Intermountain Healthcare. Let's move on to round 2.